So now we're going to go over hand expressing, which is such a great tool that we can use before baby's born for antenatal colostrum harvesting, or once the baby's here as well. If baby's ever sleeping and you're feeling a little uncomfortable and you just want that edge off, hand expression is just a great tool to have in your pocket. So when we're starting hand expression, we want to remember that our breast milk gets released from our oxytocin hormone, which is our calm and relaxed hormone. So we want to feel as comfortable and relaxed as we can. If baby's here with us, we can have them close by, do a little bit of skin to skin beforehand and get that oxytocin flowing through our bodies. Even smelling something that smells like them can really, really help with this oxytocin rush. And if they're not born yet, watching some cat videos, cute cat videos, if that's what helps you relax, or a little bit of guided meditation, whatever helps you feel relaxed. Then we're going to start warming the breast tissue up. You can use a warm flannel, a warm, not hot water bottle, or even just doing some motion. This friction of the motion can help warm all that breast tissue up. You can do this for as long, as little as you want. Before expressing as well, you can just sit there and just start stroking the breast, just getting used to touching it. Before we have babies, it can be, our breasts aren't something that we touch very often, so we just want to try and get as relaxed with it as possible. And then we're going to go on to some massaging techniques just to get ready, and this can be useful with all types of expression, not just hand expression. So using the flat part of your hand and starting right up from the collarbone, you're going to start stroking firmly, but not painfully at all, across the breast and over the nipple. And we're going to start right up from the collarbone, because our milk glands can go really far into the breast tissue, not just what comes on the outside. It goes right under the armpits as well. So starting really far back and stroking all around the breast. Our milk glands are like segments of an orange. They go all the way around the breast. So getting all areas is really important. Another massaging step is kneading. So using your hand in a fist, not using the knobbly knuckle bits, but using this flat area here. And we're going to knead from the base of the breast towards the nipple. And again, getting all of those milk glands all the way around the breast. And do this again for as long or as little as you feel comfortable with. So then we're going to get on to the actual hand expression. So we're going to use our thumb and our forefinger, and in having like a C shape, whichever way feels more comfortable for you. At the base of the nipple, we're going to start feeling into the breast, bringing our thumb and finger together while we feel the breast. And what we're feeling for is a slight change in texture. Some women describe this as a little bit of gristle, and other women describe it as like a dent inside the breast. So that's what we're feeling for. Most women find this is between 1 to 3 centimetres from behind the base of the nipple. But I always say start right behind, because it's different for everyone, and just start moving back until you find this area. Once you think you found that area, or if you're not quite sure, just try anywhere that feels right. Keep your thumb there and wrap the rest of your fingers around the breast. And we're going to start doing some compression. So we're going to bring our thumb and our finger towards each other, and we're going to squeeze and release. And we're going to keep doing that motion of squeeze and release. And I do elongate those squeezes because it is really important. We don't want to be doing quick pulses. We really want to hold those squeezes and then release them, and then get into a bit of a rhythm of squeeze and release. It can take a while for the first droplets of milk to start coming, especially in the first times we do this. And there really is a skill to it, so practice makes perfect. If after 5 minutes still nothing seems to be appearing, that's okay. Just maybe move your hands a little bit forward or a little bit backwards and start again. When we're doing these breast compressions, do try not to slide the fingers forward. That can be quite uncomfortable on the breast. We're just bringing them together from either side of the breast. Once you feel you've done that area, remember we have all these milk glands around the breast, so almost working the breast like a clock. We're going to turn round and start doing the next area of the breast. So squeeze and release, squeeze and release. We obviously want to start this with nice clean hands and having a sterile container to collect this milk into, whether that's a bottle lid, a bottle, any sterile container, or syringe as well. Colostrum comes out in thick little beads, and as you squeeze you may notice it starts to trickle and form a bead, and if you release too early it can almost suck back into the breast. So holding that squeeze until that bead forms, and then collecting that either directly into your syringe or into the container. And with your more fuller milk, it may squirt from a few areas and get a little bit messy. So having something to catch the drips, like a muslin cloth, can be really, really handy too. Collect it into a sterile container and follow the storage instructions.